Hi ladies and gentlemen, welcome to Biomedical Tutor. This is your biomedical tutorial channel, and in today's video I'm going to be discussing the hepatitis B virus infection. So firstly, let us look at the word hepatitis. Hepatitis is swelling or inflammation of the liver. That is, the liver being one of the most delicate organs in the human body. If the individual liver start to swell or get inflamed, definitely that condition is medically referred to as hepatitis. So hepatitis is caused mostly by viruses, and other causes of hepatitis include medication and toxin. So, hepatitis that is caused by virus, is caused by virus, those hepatitis are called viral hepatitis. And there are some common viral hepatitis, and they include hepatitis A, hepatitis B, and hepatitis C. Hepatitis B virus is our focus point today, among all of those viral infection. So, before getting into our discussion on hepatitis B virus, let us look at the function of the liver. The liver is one of the heaviest organs found within the human body, specifically within the digestive system. The liver, number one, it functions by producing bile or fluid that is produced within the gallbladder of the human. This fluid is useful in terms of helping to break down fat. Another thing that the liver does is that the liver combats infections and other particles that affect the human body. The liver also carry on storing process. That is, the liver store ions, the liver store minerals, the liver store vitamins. That is what makes the liver so important. And one important function that I want you to know about the liver is that the liver is also there to detoxify medication and other chemicals in the human body. So that is some of the key functions of the human liver or the liver. So if that has been said, let us look at now the disease burden of hepatitis B. Hepatitis is very common around the world. Hepatitis, according to statistics, causes about 1 million deaths annually. And every time there are 40,000 cases, new cases of hepatitis that is occurring in the world, according to statistics. So that tells you that this sickness is a very common sickness, mostly among people that have sexually transmitted diseases and people that mostly females that are pregnant. So hepatitis having been common among humans, hepatitis also spread through the vagina, fluid, semen, and blood. So when a person is come in contact with vaginal fluid, semen, and blood, and that substance enters the person's body that is uninfected, definitely that person becomes infected. How? This happens through unprotected sex, and also this happens by using sharp objects, syringe, needles, nerve, and other sharp materials that are not good. So newborn babies, in fact, they are at a higher risk if the mother is infected. That is another way through which individual contact hepatitis. Now, let us take a very clear look at the incubation period of hepatitis. When we talk about incubation, we are definitely discussing the time it takes for the signs and symptoms of a sickness or a particular sickness to occur within the individual. So the incubation period for hepatitis B infection is from 6 weeks to 6 months. So within that interval, the individual, whether it's a chronic or acute hepatitis, will experience signs and symptoms of the infection. So, hepatitis B virus, looking at the acute hepatitis um, infection. Acute hepatitis infection, that is an infection that occur all of a sudden and it's very fast in terms of its occurrence. So acute hepatitis B infection has specific symptoms. So I want us to look at the symptoms of acute hepatitis B virus. So the acute symptoms include one, fatigue, weakness, that is weakness in the human body. And another thing is that experiencing dark urine. So whenever the person goes to urinate, the urine color will be dark like Coca-Cola. You know how Coca-Cola color is like. So definitely your urine should not have such a color. Another thing is that you experience abdominal pain, you experience joint pains, you experience what we refer to as jaundice, that is the yellowing of the eyes and the skin, that is the yellowing of pigments on the human body. And another thing is that you experience what we call, in fact, that is one of the most frequent symptom of hepatitis B virus. That is the aspect of nausea or vomiting is a very cardinal symptom of hepatitis B virus. So, having said that, let us now look at the chronic hepatitis symptom. So, specifically, chronic hepatitis symptoms, they are not really something that is vivid, because the chronic hepatitis is an asymptomatic in most individuals. So for that reason, you will observe that people that come down with a very chronic level of hepatitis B virus infection will be very asymptomatic. So in that case, it is a very dangerous case for such an individual. So hepatitis is not a virus infection that people joke with. This is the reason why we must know about this virus and know how we can prevent ourselves from this virus infection. So let's look at the risks of hepatitis B virus infection. Now, those that are at higher risk of contracting hepatitis B infection, one, are those that have unprotected sex. Your sexual partner may be, the male might be infected or the female might be infected. So sexual partners should be very careful with who you meet and who you have sexual intercourse with. That is, it is better to prevent yourself, because hepatitis is transmitted sexually. So unprotected sex is capable of transmitting hepatitis B virus. Another way is by having multiple sex partners. If you have multiple sex partners, it is difficult to distinguish among the sex partners who actually has the infection or who will actually give you the infection. And another group of people that are high risk are those that frequently have episodes of sexually transmitted diseases. That is gonorrhea, syphilis, chlamydia, trichomoniasis. These are all infections that people who contact sexually transmitted diseases, they are at higher risk of contacting the infection of hepatitis B virus infection. So another people that should be very careful in terms of their risk to contact this infection are those that work in the health sectors. That is the nurses, especially the laboratory technician. Exposed to blood that is infected by hepatitis B virus, definitely that person will get infected by the virus. So, having said that, let us try to conclude this by going to the prevention of hepatitis B virus. One is to avoid um, having sex without using condom. It's important that we have sex and use condom in order to avoid that. Another thing is that people who are pregnant can go for their routine checkup to know whether they are infected by the hepatitis B virus. So that is again those who are infected mothers and they have the child should be go for immunization by taking the hepatitis B vaccine to as a prophylaxis to prevent the child from contacting the infection. Then another way to stop or to prevent yourself from contacting hepatitis B virus is to avoid using sharp objects that have been used. Every sharp object, needles, syringes, nails, etc., should be disposed after use so that you cannot contact any infection like hepatitis B infection. So second to the last to this discussion is the diagnosis. How can hepatitis B virus infection be diagnosed? Good. Hepatitis B virus can be diagnosed by examining the liver. And how do we examine the liver? That is by taking specimen to the lab in order for tests that specifically relate to liver function, because we say hepatitis B virus infect the human liver. So one of the tests that you can do as a health professional to diagnose a hepatitis B virus infection is the albumin test. That is serum albumin. The serum albumin is a blood plasma protein that you can detect to know the high level of it, which will indicate that the person have a hepatitis. That is just one. Another test you need to do is the big one. Boom, the liver function test. During the liver function test, it was very important because you are going to analyze enzymes that help the liver to function properly, such as the ALT, the AST, the bilirubin. That is going to do direct and indirect bilirubin. As a health professional, you know what I'm talking about. These are tests that you can use to diagnose hepatitis B infection. Then the next thing is that the prothrombin time, to know the coagulation factors that are formed within the human blood. So, and that is another way to detect it. And there's a possibility of having the infection. Your health care provider should give you the best and possible management for this infection. So in terms of treatment, acute hepatitis most of the time will come on its own and just get silent on its own. But why is recommended for the case of acute hepatitis infection is to drink enough water and eat healthily so that you get more bed rest and help the body overcome the infection. Mind you, if the infection is very chronic, there's no cure for hepatitis B virus infection. So the best possible treatment for that, if it is in the case of chronic hepatitis B infection, that is surgery, liver transplant. Good. So that's it. Thank you for your time today. And next time we will be discussing another interesting thing. Please do not forget to subscribe to our channel. Thank you.